Meantime, Virginia has fully vaccinated almost 23% of people. 38% have one shot so far. In North Carolina, 32% of people are fully vaccinated and 45% have one shot. Now, with numbers like that, you'd think that we still have a lot of people jumping at the chance to get a vaccine.
But now we're seeing local cities reach out to the public to let them know that there are still plenty of shots ready to go. 10 of your side's John Dowding is looking into how cities are doing that tonight. John?
Well, Tom, many local health departments have been resorting to those tried and true methods of outreach, like going door to door to meet with people. But overall, most health departments say the most important goal, however, is to eliminate any potential barriers preventing people from getting the vaccine.
We got to get the message out, right?
With a steady supply of vaccines, public health officials are working to have a steady supply of people to receive those vaccines. They've begun changing up how people can get a shot with walk-in appointments at certain locations.
We realize individuals aren't always able to come during the workday to this site, may not feel comfortable in a very large city site like this and prefer something in their own community, so we're working through that angle.
Before getting people that life-saving shot, they're hitting the pavement and doing everything they can to dispel any misinformation about the vaccines and meeting people in their own backyards.
We're literally knocking on doors, going to community centers, going to recreation centers, and we're really trying to identify community individuals who are trusted, who could be our messengers within the community.
In Chesapeake, the health department has over 50 different partnerships to spread the word about where and when to get vaccinated. One partnership is even helping bring people to their appointments.
We've also partnered with Hampton Roads Transit to get free transportation vouchers or passes for those that may have transportation needs to get them to and from our vaccination sites.
As Chesapeake moves to phase 2, public health officials say they're focusing their outreach on underserved communities and homebound patients.
This is a population that we want to make sure that we appropriately engage, because they may not have all the capabilities that the rest of the population have.
And Chesapeake also created a call center for those people who don't have internet access so they could still schedule their own vaccines. Overall, officials say, though, the key to reaching herd immunity is with those hyper-local community vaccination sites they're developing right now. John Dowding, 10 on your side.
Gotta get those shots into arms. Thanks, John.